So let's talk about weight loss and let's talk about metabolic issues and all the consequences related to that. We know this is a major problem in the healthcare system. It impacts cardiovascular outcome, it impacts blood pressure, it impacts diabetes. We know this is a major problem that we're seeing across patients, across family members, and it's confusing, and everybody's trying to figure out what to do. Um, so let's take a deeper dive. Let's look at what led us to bring out this GLP balance product, the Agaricus bisporus mushroom, and how this whole thing came to fruition. My name is Dr. Matt Hand. I'm the Chief Medical Officer for Square One Health. And I want to get into the study. I always say get a little geekier with it as to why this product seems to work, or what the study was that showed that this product was helpful. The study came out in 2020. And it was based off of in vitro studies that actually looked at a water-soluble polysaccharide from the agaricus mushroom. And it seemed to bind with fat. There was a cationic polymer that ultimately led to fat holding on to fat and kept fat from being absorbed, which theoretically is a great idea. And I mean, you have to be careful about not absorbing all your fats, but that would be almost impossible. But to decrease some of the fats, and in particular to have an impact on cholesterols and LDL cholesterol, it would be very positive if we could see that happen. And in particular, because these are not things that are actually getting into the body and changing enzyme function or other things that happen, which can lead to increased side effects. So in order to study this, the group took 100 people. They started with 100. It was a placebo-controlled trial. And they said, we're going to put 50 over here and 50 over here. Well, they had about 5 people drop off, 2 from one group, 3 from the other group. But the group was essentially identical. They had equal calorie intake. If they looked at their overall exercise, that was essentially the same. There wasn't a big difference between the two groups. Their weights were very similar. Their waist size was very similar. Their BMIs were very similar. Their cholesterols and LDL cholesterols were very similar. So it was a good look at two groups that were very similar in terms of how they were made up. They said, don't change your life. So they did not want people changing what they were doing because they wanted to see if this worked in reality. Not something where we just said, well, we're going to make it extremes for people that couldn't do what needed to be done in order to see what the outcome would be. At least that's what the authors were reporting. So they said, let's start when we'll follow people every 4 weeks. So every 4 weeks, they would look at the various parameters, and the primary parameters were weight loss, were waist size, were LDL cholesterol, and were total cholesterol. And they looked at it 4, 8, and 12 weeks. By the end of 12 weeks, there was a statistically marked difference between the two groups. So the placebo group had almost no change. They stayed essentially the same, a little bit up, a little bit down, but really did not have much of a change at all in terms of their response, which would be expected. There was a statistically significant change in the agaricus, or the H2O Slim product, the GLP-Balance product that we have through Square One. They found an 11-pound weight loss. They found a 5-inch change in waist size, and they found that the total cholesterol went down, by 21, and the LDL cholesterol went down by 27. Again, statistically significant, in particular when compared to the control group. This is really great. There was very little in the way of side effects. There might have been a little bit of GI side effects, but not much. And it really wasn't different from one group to the other. So here we have about 50 people in each group living their lives as they normally would without changing things around, adding in this polysaccharide from the agaricus mushroom. 400 milligrams was the dose, which is the same that is in the product, GLP Balance. And they found a statistically significant change in those parameters. Again, we're talking about best ways to improve health, right? If we simply look at the single leaf of the tree, we miss the beauty of the thousand leaves. And our goal is to get the tree healthy. And we're not saying this is the end all be all of weight loss or metabolic syndrome. What we're saying is that when it's very important, very, very important to look at food, movement, exercise, stress reduction, all those parameters. But when you're starting from square one, so when people are starting out, that's why we're Square One Health. If you're looking for something to help you get to that place, this product seems to be very well tolerated. The study shows that it seemed to work and seemed to be helpful. And looking forward to looking at this even in more depth. But that's what we found from this study. I wanted to take it a little deeper for everyone so that they could have an understanding as to how these products came to be and why we're using them. And we'll move forward. If you simply look at the single leaf of the tree, you miss the beauty of the thousand leaves. So let's keep the tree healthy.